After time, kids, both children and teenagers, present with me with the symptom or symptom diagnosis of anxiety disorder, and I have seen sometimes they have been taking, the medication like SSRI, Prozac, and Lexapro. But when I take history and try to understand, and many times, I have found this pattern that kids are going through anxiety, especially around exam time, like, a couple of days before exam, they are going through, heart is racing, sweating, shaking, feeling nervous, problem sleeping, and lot of irritability as well. And when I explore, the symptom more, often I found that these kids have been struggling with inattentiveness, problem paying attention, easily get distracted, zoning out, making a lot of careless mistakes, even in the subject that they are good at, and being forgetful to submit the assignment, forget to do their homework, and procrastinate. They put the difficult things at the end, and that's how, just before the exam, when a lot of difficult things they need to finish which they were supposed to do before, and a lot of homework they may not have done, and now they have to catch up, so they may present as an anxiety symptom, but actually they are struggling with ADHD. And unless you treat ADHD, it's very hard for their anxiety to get better as well. So it's very important to diagnose what is the underlying reason for the current presentation.